I see Assemblymember Soria in the audience. Thank you for joining us this morning. You've got agenda item number 6, AB 2010. And just hit the little, there you go. Thank you.
Sorry. Good morning, Chair and members. I would like to start by accepting the committee amendments, and I want to thank the Chair and the committee staff for working with us on this bill. AB 2010, the Spay Neuter Improvement for Pets Act, also known as the SNIP Act, permits high-quality, high-volume spay and neuter to be performed in locations without separate surgical suites, while maintaining California's high health and safety standards for veterinary surgery. California is in the midst of a multi-decade pet overpopulation crisis, which has only worsened since the pandemic. While there are many contributing factors to this crisis, the simple fact is that California's veterinary shortage has meant that the number of animals spayed and neutered every year has not kept up with the number of pets that need these services. This has led to severely overcrowded shelters, large numbers of stray and abandoned animals, and hundreds of thousands of healthy animals are euthanized every single year. The crisis is even more dire in rural regions like the Central Valley, where the nearest access to spay and neuter services may be an hour away and unaffordable to many disadvantaged communities. I've heard it directly from many of my communities that they need more help and support to address this crisis. Fortunately, high-quality, high-volume spay and neuter offers a pathway to address this growing crisis. Just a few weeks ago, I toured the City of Fresno's Animal Center, something I helped support when I was on the City Council, and saw Animal Balance in action, delivering high-quality, high-volume spay and neuter services. It was impressive, and it reinforced something we already know. We have solutions, we just need to scale them. The only issue was that the Fresno Animal Center is far away from these communities like Kalinga and Kerman and Mendota. So we need to make sure that these are more accessible and in the communities. So while a veterinarian using traditional spay and neuter techniques can help less than 10 animals a day, high-quality, high-volume practitioners can safely help many times that number, as surgeries are much quicker through the use of efficient workflows and the smallest incisions possible. I will tell you, I saw them, and they were really, really efficient. However, regulatory barriers currently not only prevent high-quality, high-volume spay and neuter from being used to its maximum potential, but it prevents the use of mobile animal sterilization hospitals, or known as M.A.S.H clinics, which can bring those traveling high-quality, high-volume units to operate in the underserved and rural areas. AB 2010 addresses this issue by creating targeted exemptions for high-quality, high-volume spay and neuter from existing requirements for aseptic surgeries to be carried out in a dedicated surgical room free of shelving and with equipment for viewing radiographs. Exemptions from these standards will permit these M.A.S.H clinics to perform affordable pop-up, high-quality, high-volume spay and neuter events in communities with the greatest need while still meeting high standards of health and patient safety. Because in places like Fresno, Madera, and the high desert, and across the Central Valley, families often have to drive more than sometimes an hour to see a veterinarian. That's not access, that's a true barrier. My office has had productive conversations with the Veterinary Medical Board, and I'm committed to continuing to refine AB 2010 to provide the best possible implementation of our shared goal to increase access to affordable, high-quality, high-volume spay and neuter services. The SNIP Act provides a much-needed fix to allow spay and neuter services at the scale needed to meet the public need. And with that, here with me today to testify in support of AB 2010 are Emma Clifford, Executive Director and founder of Animal Balance, and Dr. Grant Miller, Director of Regulatory Affairs for the California Veterinary Medical Association.
Great. You have 2 minutes each.
Good morning. Chair and members. My name is Emma Clifford. I am the president of Animal Balance, an organization who has brought M.A.S.H and M.A.S.H-style clinics to communities internationally and now in the United States since 2020. M.A.S.H, or Mobile Animal Sterilization Hospital, is an effective, safe, replicable, and scalable strategy for reducing the overpopulation of cats and dogs. M.A.S.H events are accessible for all communities. M.A.S.H has been proven on the Galapagos Islands and done successfully in several states by Animal Balance. With the passing of AB 2010, this effective international strategy will come to California, saving hundreds of thousands of lives and dollars. Through temporary, targeted, high-quality, high-volume spay-neuter clinics, M.A.S.H reduces overpopulation across communities it serves by stopping the breeding of cats and dogs. The M.A.S.H veterinary teams deployed to the communities in need with all the veterinary equipment and set up in the clinic inside one large room, such as a community centre. Local partners provide the volunteers to perform all the non-medical tasks. These are true community-centred events. Under the current law, M.A.S.H events must fit inside existing clinical facilities that have a surgical suite, which is surrounded by walls and a door. These facilities were not built for high-quality, high-volume spay-neuter clinics, and the requirements never contemplated this type of innovation for spay and neuter. True M.A.S.H clinics are set up in a circular fashion inside one room, spaying and neutering approximately 80 animals a day. Using one room, the surgeons can see and hear the recovery area, which is where the animals are waking up from anesthesia, the most critical point in the process. Over 200 surgeries can safely be performed over 3 days in any location. M.A.S.H clinics reduce the number of unwanted animals who end up in shelters, reducing euthanasia. Reducing shelter impound saves funds at every level of California government and aligns with a state policy that no adoptable or treatable animal should be euthanized. Let's pass AB 2010 and progress towards ending the overpopulation of cats and dogs together. I respectfully ask for your aye vote. Thank you so much.
Thank you. Go ahead.
Good morning, Chair Berman and members. Thank you so much for hearing this important bill today. Also, thank you to the Assembly BMP staff for your suggestions to make the bill better, and to Assemblymember Soria for tackling this very important barrier. The Veterinary Medical Association is very pleased that we are now thinking outside the box in trying to solve California's epic pet overpopulation problem, which has plagued our state for over 50 years. The veterinarians have played by the rules. We've done everything that we can do within our veterinary hospitals, but it's very evident that we need to get more aggressive with solving pet overpopulation. And the M.A.S.H-style clinics that Emma Clifford and her types of group provide are just that answer. It's remarkable to think that you can perform 30 to 40 surgeries in a day and successfully remove an organ from an animal in that volume, but that's exactly what they've mastered in doing, and we want to help clear the way to make that easier for the state of California. So the surgery room requirements that we're asking to be exempted from are very reasonable, and we do believe that these animals will remain safe. We've been shown through all of the research and data that they've collected from the hundreds of thousands of animals that have received the high-quality, high-volume spay-neuter, that these animals walk away from this procedure fine. They go on to live perfectly healthy lives. And so we believe that finding this compromise where we're removing very specific select surgery room requirements in order to facilitate this is a win for all. We're very excited about this bill. We believe it's a piece of a larger puzzle that we need to continue to put together to solve these problems that we've had. And we're very much appreciative of all of those who are willing to lend a hand. So we're asking that of you today and respectfully ask for your aye vote. Thank you.
Thank you. Any additional witnesses who want to add on in support of the bill? Any additional witnesses who want to? Oh, come on up. Perfect. I know it's a crazy time in the hearing room today.
Good morning, Chair and members. Juliana Tetlow on behalf of San Diego Humane Society, proud co-sponsor in strong support.
Thank you.
Good morning, Chair and members. Karen Stott here on behalf of the Animal Legal Defense Fund in support. Thank you.
Thank you.
Dear members of the Assembly, my name is Mary Dricelao. I'm a staff attorney with the San Francisco SPCA's Shelter Policy and Legal Services Program, which provides support to shelters and rescues around the state in areas directly related to this bill. The SFSPCA is in full support of AB 2010 because we believe that sterilization is the only tool we have to combat overpopulation.
Thank you very much. And we're going to try to set an example for everybody else in the hearing room. Just provide your name, organization you're with, if any, and position on the bill. Thank you very much.
Mr. Chair. Bob Gutierrez with the San Francisco SPCA in support.
Thank you very much.
Good morning. Karen Lang on behalf of the Humane World for Animals, as well as the California Animal Welfare Association in support, and thank you.
Thank you.
Good morning. Josh Gallagher on behalf of the Riverside County Board of Supervisors in support.
Thanks so much. Any primary witnesses in opposition to the bill? Come on up. You all have 2 minutes. You can come up to the table. And just get the little microphone button.
Good morning. I'm Julie Verga, president of Fix Our Shelters. Our coalition of animal rescue and advocacy partners across the state of California support the California Veterinary Medical Board's oppose unless amended position on AB 2010. All agree increased spay, neuter, and TNR resources are key to reducing shelter intake, high euthanasia, and our epic overpopulation crisis. But should years of failed policies espoused by the key sponsors of this legislation justify lowering medical standards that could easily expose animal patients and consumers to significant risk? Without addressing the disastrous and unlawful policies of reduced intake that continue to turn animals away at shelters, all the spay neuter in the world will not be enough. Leaving animals to breed, suffer, and die outside shelters has clearly failed animals and our communities. It's failed public safety and trust and simply defies logic and common sense. The same could be said for AB 2010 as it ignores the vital role the Veterinary Medical Board plays in protecting animals and consumers. High-quality, high-volume spay-neuter surgery is a specialty whose success depends on experienced and highly trained surgical teams. Spay procedures are invasive abdominal surgeries requiring strict adherence to sanitary protocols. Even slight differences in surgical experience and training and the variables inherent to temporary or multi-purpose surgical settings can greatly impact patient and consumer risk. The Veterinary Medical Board's process exists to evaluate these risks through a clinical and specific scientific lens. Circumventing that process substitutes policy expediency for medical oversight. The key sponsors can use their vast resources today to increase spay-neuter capacity across the state.
If you could wrap up, that'd be great. Thanks so much.
In the meantime, please oppose 2010 until these amendments come forth. Thank you very much.
Thank you.
Good morning. Top Cat Rescue strongly supports expanding access to high-volume spay, neuter, and TNR services, especially for cats who have borne the brunt of failed policies pushed by the sponsors of this bill. However, relaxing vital veterinary regulations will not increase access, only funding will. The sponsors will, with combined resources exceeding $300 million, can provide real solutions by funding low-cost spay-neuter through existing compliant high-volume providers. This overpopulation and euthanasia crisis was driven in a large part by reduced intake policies promoted by many of the same organizations supporting AB 2010, policies that resulted in unsterilized animals being turned away in violation of California law. Until shelters stop illegally turning away unsterilized cats and kittens, we are simply chasing our tails. Further, AB 2010 bypasses the Veterinary Medical Board's regulatory authority, the body charged with protecting animal and consumer safety. Animal Balance is currently the only active MASH style operator in California and has been operating outside veterinary guidelines for nearly 2 years, increasing its revenue by over $1.5 million. What happens when standards are relaxed and less experienced operators follow? High-volume surgery requires specialized skills and oversight. This is exactly what the Veterinary Medical Board is meant to regulate. These clinics are not low cost, approximately $43,000 for a 3-day event, requiring 12 to 14 local volunteers per day with no consistent follow-up care. Cats and kittens need help, but through the veterinary medical board's process, not around it. If the sponsors truly want to help, they can fund compliant providers and stop policies that violate the law. While well-intentioned by the author, AB 2010 ignores critical safeguards and will not solve this crisis. Respectfully ask for your nay vote for 2010.
Thank you very much. Any additional witnesses who want to add on in opposition to the bill? Give us 1 second.
Good morning, Chair and members. My name is Matthew McKinney, Deputy Executive Officer for the California Veterinary Medical Board. Our board has an opposed unless amended position on this bill. Our proposed amendments are to address clarity and implementation concerns. We look forward to continued collaboration with the author and sponsors to address these concerns. Thank you.
Thank you.
Good morning. I apologize for testifying out of order. Brittany Bennessy on behalf of the ASPCA in strong support. Thank you.
Thank you. Bringing it back to my colleague for questions or comments. If not seeing any, Assemblymember Soria, would you like to close?
Yes, thank you so much, Chair, again, for the opportunity to present this. I just, for the record, I want to make it very clear that in my district, the communities that I'm trying to help, there are no shelters nearby. There are no veterinarians that live in their community, and this bill actually will remove those challenges and barriers where these pop-up clinics can come and help address the overpopulation crisis that many of my rural disadvantaged communities are. And that's why I am doing this bill. So I want to thank you guys for working with us. We recognize, that there's been additional proposed amendments. We look forward to working with those that are willing to want to do the work and actually provide some additional tools, because we know that sometimes in the regulatory arena, it takes 3 to 4 years to pass regulations, and we can't wait for another 3 to 4 years. We need some actions today. And so thank you so much for your willingness to work with us. I respectfully ask for an aye vote on AB 2010. Thank you.
Thank you, Assemblymember Soria, for bringing forward this important measure to address the pet overpopulation crisis. It's critical that low-cost services reach communities that don't have access to a traditional vet clinic. I understand that you are working through feedback from the Veterinary Medical Board, and I trust that you and your sponsors will work to address their concerns. I'm happy to support the bill today when we have a quorum. Thanks so much for your presentation. And I believe you're also going to present agenda item number 7, AB 2195. Great. So we're ready when you are. Yeah.